Morning, everyone. Thanks for joining us here on Skeena Strong. This is Fighting COVID in the Skeena, episode 7, Variants and Vaccines. And we're so glad that you could be with us tonight. Of course, with me, as always, is my co-host, Christine Smith-Martin, who is a member of the Tsimshian and Haida Nations. And of course, I'm Dan Messick with Skeena Strong, based here in Smithers. Christine, tell us a little bit about who we have on the show this evening.
Well, hi, I had every intention of introducing all of them, but some of the amazing work they do, I honestly can't even pronounce some of it. So I thought it would be better for them to introduce themselves. So maybe we'll start off with Krishana, and then we'll have everybody join on, and then you can introduce yourself.
Sure. Thanks so much, Christine. So I'm Krishana Sankar. I have a PhD in molecular and cellular biology. I've got over 10 years of research experience, and I am also part of COVID-19 Resources Canada. So we have been doing these kinds of episodes for the Skeena Strong team, and I've also been doing a lot of vaccine education and vaccine outreach, not only within Canada, but also in my home country of Guyana. So I'm really excited to be here tonight, especially alongside my colleagues, Dr. Janet Valdez and Lindsay Dixon.
Thank you. Lindsay?
Yes, thank you so much for having me here. My name is Lindsay Dixon. I am a pharmacist. I've practiced for over 10 years in community pharmacy, predominantly in community management. I was an associate for Shoppers Drug Mart for quite a few years. I've been reporting on COVID-19 since March of 2020 and also reaching out to the community. I'm a volunteer with COVID-19 Resources Canada.
Thank you, Lindsay. And last but not least, Dr. Janet Valdez.
Thank you, everybody, for having me here. I'm very happy to be around. My name is Janet Valdez. Again, I have a PhD in microbiology and immunology. Before continuing, I would like to acknowledge that I'm calling from the ancestral and unceded territory of the Salish and Musqueam people. So today, it's an honor to be here. We are celebrating the Day of the Immunology. We are celebrating vaccines all over the world and immunizations. So I'm happy to be celebrating with you. My background is in bacteriology, microbiology, and immunology for the past 25 years. I also want to say that I am the volunteer lead in BC for COVID-19 Resources Canada. Thank you.
Thank you. Thank you for our wonderful guests and joining us tonight. And Dan, can you give us a sort of snapshot of what's happening, not only in the North Coast, but all over the world?
Yeah, of course. We've talked a lot about COVID-19 over the last year, and we're into the second year now dealing with a global pandemic. And here in the Northwest, we kind of got out a little bit unscathed in the first wave about a year ago this time, but things have changed quite a bit in the last year. So I'm going to just share some slides here very quickly so we can take a look at some of the numbers that have been coming through over the last year. So let's take a look here, if you can see my screen now. So this is a quick snapshot of where we are here in British Columbia. So we're in a third wave right now. We saw the first wave, like I said, that here in BC, that we didn't see a huge uptake in the Northwest, but the second wave we did, and now in the third wave, it's gotten quite a bit worse here in BC. So we're tracking this, as you can see, is about 100,000 people. So per cases daily of 100,000 people, we're tracking about 20 here in BC. So 20 cases per 100,000 people in BC. And the next slide here we'll take a look at is going to give you a little bit of a snapshot of the other provinces. So we're doing a bit better than Alberta, not so much better than Nova Scotia. They're doing quite well. However, they are starting to see a little bit of an uptake in their third wave. And of course, we're tracking very close to Ontario, which is also dealing with a lockdown, stay-at-home order in much of the province at the moment. So we'll take a quick snapshot here of what it looks like internationally. Of course, we see a lot of this in the wider media of what the picture looks like internationally. So of course, lately we've been hearing lots about India with many of those variants that they're dealing with. And you can see that it's tracking upward. However, only about a fifth of the cases in India are being reported. So this isn't giving us an exact, accurate depiction of what is happening on the ground floor in India. Of course, New Zealand is kind of the good news story. That is, they only have about less than one case per 100,000 people in New Zealand right now. So it's quite interesting. They've done a pretty good job with lockdowns and making sure that they get on vaccines and masks. And you can see it represented here. Obviously, Sweden, a little bit of a different case there. They've seen massive cases in the second and third wave. And of course, in the US, we're tracking quite similar to the US now. We're actually across Canada, we're a little bit worse than the US in terms of the cases. But you can see here, we're tracking here in BC very similarly to the US. And then finally, we're going to take a look here at the Northwest for the moment. And the third wave, clearly the worst of the pandemic that we've seen here in the Northwest, but it's come down quite a bit in the last little while. And we're going to get into that a little bit later. And of course, this is in relation to the other health regions across the province. So the Northeast, we're still seeing them tracking quite high in terms of the caseload. And then down in Fraser South, the same ways. And we see the interior that has dropped off quite a bit. What we didn't see a very high second wave, definitely not as high as it has been here in the Northwest. And now quickly, we're going to take a quick picture of what it looks like specifically to our local health areas. And I want to draw your attention to one point that we're going to get into with our experts. So here, March 14th, so this is over a month ago in Prince Rupert, we saw a lot of cases, 113 cases in Prince Rupert. There's about 12,000 people in that community. So that's quite a lot of cases that they were seeing in that week. And then slowly over the last month, we've seen that caseload come down. So 80, 72 at the end of March and early April, 27 only a couple of weeks ago, 2 weeks ago, and last week we saw 2 cases in Prince Rupert. Now, this is also at a time that there were other things happening in Prince Rupert, but we're going to talk to our experts here about why we saw that kind of numbers come down in Prince Rupert over the last month, and it might have something to do with the vaccines that are being rolled out. But Christine, maybe you can give us a little bit more about what you're seeing in your neck of the woods.
Yeah, no, it's been amazing to watch. It wasn't amazing to go through all of this because we were getting quite high numbers. I lived in the Nisga'a Nation, and we were the sort of first ones to get mass rollout of vaccines. Our cases hit pretty high, and so we were the first ones. And then Prince Rupert as a city, it was amazing to watch. I was born and raised in Prince Rupert, and to watch not only how the health authority handled it, the volunteers that came out, they had singing that was happening there. Every walk of life was going down. I remember one of my aunts saying, I'm going to round up all my kids and make sure they get down there to get their shots, because Prince Rupert was really lucky in the first wave and a little bit of the second wave, and then they got hit. And unfortunately, you know, the Acropolis Manor was the first to get hit, and where they hold our most precious elders there, and we lost some elders from our communities. And so the wave just went, and it really was a wave. They were sending people out of Prince Rupert to other hospitals. It was really bad. So I think this was a great approach they did. They took the hot spot, they brought all the vaccines, and they did a mass vaccination there, and it has really transformed. And I guess, you know, we'll probably talk a little bit more about this, but you know, people over there are saying, well, now that we've had our first one, you know, why are we still shut down? I understand other people haven't had theirs, but we have, and we've only been down to 2. So it's been wonderful to watch what they've done in that community. And they've duplicated it all over BC as well. They've taken that approach, that model, and they've duplicated in other communities.
Yeah, and we have a quick word here. I was able to speak with Dr. Raquel Kling. She's a medical health officer from Northern Health who oversaw some of what was going on with the Max community vaccination program that they launched in Prince Rupert. And so we're going to play a quick clip from her. She's going to give us a little bit of a rundown of what happened in Prince Rupert and why it is such a good news story, especially right now where we are seeing a lot of cases growing, not only here in BC in certain parts, but across the country and the world. So let's take a quick listen to what Dr. Raquel Kling had to say about the mass community vaccine program in Prince Rupert.
So hi, my name is Dr. Raquel Kling. I'm a medical health officer in Northern Health. So I just wanted to talk today about the Prince Rupert Vaccination Clinic, which we think is a huge success and really shows how well vaccine is working. So the vaccine clinic was rolled out for about 8 days in March. And we, over the course of those 8 days, about 90% of eligible people in Prince Rupert proper got vaccinated during that time. And, I think about 70% of everyone in, the greater Prince Rupert area got vaccinated. So, those numbers alone just say what a huge success story it is. And the other, the big success that we can see from this is that the graphs and the data clearly shows what a marked decline in COVID cases we saw from after vaccination. So, Prince Rupert went from the community with the highest rate of COVID-19 in the province to, basically not having COVID at all in that community. And, that's just amazing. And it's so encouraging to see. And I really attribute the success of this vaccination campaign and, the low COVID rates, not just to the vaccine campaign, but just what a commitment this community had to responding to COVID and how they really just rallied and showed up to support the vaccine campaign and to rally against COVID. So we had a huge number of community members support the vaccine clinic, either through working there or volunteering. It was just a sense of community there to support the community to get vaccine. And I think that really, helped instill how important COVID is. How important it is not just to get vaccine, but I think, another thing this shows is that the community really recognized how important COVID is, and they not only got vaccinated, but, continue to adhere to all of the guidance as well, all of the public health guidance to stop the spread of COVID. So I think the vaccine had a major part, but also just, the community playing a role in decreasing COVID was, the main success story I saw. Yeah, it was just, as far as I know, it was just, a community-wide response to it where, it was not just Northern Health staff supporting the clinics. There was, volunteers, there was nurses from all over BC that flew in to support the clinic. So it was just a, monumental effort that, everyone really showed up for to support getting Prince Rupert vaccinated.
So there we go. There's a little bit of a note and a brief about what happened in Prince Rupert. So a really good news story at this point. And I was able to talk to Dr. Kling about, where else are we going to see these community vaccine programs? They are trying to roll them out in Terrace, in Kitimat, in Smithers. There are some obstacles. They are trying to overcome them. Of course, challenges in trying to immunize an entire community are not small. But definitely here in my community in Smithers, I've been hearing a lot more from people who are registering, who are getting out there. Anybody 18 and older now can register to get their vaccine, and we're starting to see it roll out. Also, Bonnie Henry, we're hearing the other day saying that in the next 8 weeks, we should see most people, if not all in BC, have availability to get their vaccine. So a lot of good news coming out after almost, a year and a half of COVID-19 kind of taking over our lives. So this is a really good news story coming out of Prince Rupert.
Absolutely. And I'm really curious, and I guess it would be a good segue into our guests tonight. We all have our own theories as to what's happening and what we're seeing in the North anyway. What is your sort of understanding of what's happening? Well, maybe we'll start with Krishana. what you're seeing in Prince Rupert and the northern communities, and especially in the Indigenous communities as well, like the communities that I live in, it has made a significant difference as well in terms of the COVID cases going right down once all the people are getting vaccinated.
Yeah, so I'm gonna defer this to Dr. Valdez because she's in that area, so I think she can probably touch on it a bit more, especially with the variants and the vaccinations.
Perfect. I guess I can share this now, my screen. Can you all see? Yes, I guess. Can you guys see everything?
Yeah.
Yeah, I think we are approaching what we call it in pathogenesis, this tug of war between vaccines and variants, in which we are bringing vaccinations. However, even though we understand that the vaccines are working, so the virus. So we are in that situation. And I think this is what is happening now. And just to refresh your memory, we talk about vaccines all the time. I just want to remind you what is a variant. So variant is a mutation or a mistake in the evolution, in the process of the virus infection. So this is a normal process. So every time that the virus infects a person, the virus multiplies inside the cells of the person. So this process is not perfect. So the virus makes mistakes and trying to copy its genetic structure. So then there is a mutation. So these mutations are happening all the time, and they are by chance. Most of these mutations, we don't give them importance because the virus died and it's gone. So there's not much consequences. However, over time, these mutations accumulate, causing variants that are so different to the parental strain, so causing more and more problems. So that's what we call it variants of concern. So we need to understand that the variants will be happening only while there are infections. So if we stop the infections, there will be no variants. So right now, at least in Canada, we have three main variants of concern. And these are the B117 that was originally first detected in the UK, the B1351 that was originated in South Africa, and the P1 that was originated in Brazil. They have different kinds of mutations that had accumulated over time. So what is important about this is because these variants are different than the original virus because they could be more efficient in transmission. They have reduced antibody binding and immune protection. And also we have seen that there is reduced vaccine efficacy against those variants. So this is the data that we had about those variants in Canada. And we can see by April 27, we had those variants in different amounts, in different percentage, in different parts of the country. If we focus here in British Columbia, we can see that the main variant is the B117. And also we have the P1 variant that is very common here, unlike other provinces in Canada. Drilling a little bit further, we can see now this is in BC. In BC, we can see that the B117 variant is very common in the Fraser Health Authority. Unlike in the Vancouver Coastal Health, we have that variant. However, we have much more of this P1 variant. So we can see the dynamics. So each town, even though they are neighbors, they have different kinds of, or different rates of infection with a different variant. Luckily, in the Northern Health Authority, we have very very low numbers of these variants. So maybe that's what is happening. So what is also important to notice is that the demographics of the infection is changing in Canada. And this is mainly, and that's my hypothesis, and I think it could be demonstrated with data eventually, is because we introduce vaccination, we can see that the older people are less affected. However, the young people below 19 and in this area, 20 to 29 are getting more infected. And this is probably because of the new variants that infect more these people. So again, we are at this point in which we don't know exactly what is happening, but the hypothesis is that we're introducing vaccination. However, we are combating against these new variants that are happening all the time. So I think it's important to recognize that we all need to work together as a community, as the community that we talk about in the North, that we can stop spreading the new variants and work together against this pandemic. I think that's it.
Thank you.
I don't know if that answered your question, or do you want me to?
Well, I guess I have a couple of questions, and I think that, I always say my kitchen table is a great place for that we always hear on the news about these new variants, and then we get a little bit panicky because we think, do we have to get another shot for that? Does this one cover it? Does it impact us differently as well? So maybe you can talk a little bit about the immunization that we got, and then what does that cover?
Yeah, so I can start off. So I know right now in Canada, obviously, we have 4 different vaccines that have been approved for use. And so we've got Moderna, Pfizer, the 2 mRNA vaccines. We have AstraZeneca and J&J, which are the viral vector vaccines. And of course, their method of work, their mechanism of the way in which they work, is different. And so right now, especially what happened in Prince Rupert is amazing, this mass vaccination clinic that happened. So it's essentially a pop-up in a hotspot, which is essentially what we're trying to also emulate here in Ontario, but I can probably save my comments for that a little later in terms of how it's actually being rolled out in Ontario. But I think that model makes a lot of sense. And like Dr. Valdez showed just now, with all the data that she showed, I think a lot of us can appreciate the fact that our seniors who were at first prioritized for vaccination, they're doing a whole lot better. And it's kind of obvious why that is. They all got vaccinated. In the beginning of the pandemic, when a lot of our seniors were extremely vulnerable, because especially those living in long-term care homes, were in congregate settings. And so were the healthcare workers who were with them. And so by vaccinating them, now if they get infected, they wouldn't, have such severe disease, they wouldn't end up in hospital and they wouldn't die. And so we're seeing the same thing also mirrored here in Ontario. So I think the next, obviously, like when it comes to priority settings, the obvious next step is for those hotspot areas, or we call them hotspot areas, or the areas that are hardest hit by the virus. And so mass vaccination is obviously helping, but obviously another piece of it we have to keep in mind is the public health measures that we have to continue following in the same time. Yeah, so I don't know if Lindsay or Dr. Valdez wanted to add to that.
I think one of the questions I had for Dr. Lindsay is talking about, one of the criticisms is that we haven't really utilized our pharmacists throughout BC. And I know every time I get my flu shot, I go into a pharmacist and get a flu shot, then I sit there for 15 minutes and then leave. So maybe you can also talk to us a little bit about that. Why haven't we used them, and are they starting to roll out now?
I can definitely speak to that. So yes, we are starting to see vaccines in pharmacies. Now this rolled out, the pharmacies actually got very short notice about this in British Columbia a few weeks ago, and we were given the AstraZeneca vaccine. However, one of the big issues, as has been the issue since the beginning in Canada, is supply. So we have a lot of demand and we have very restricted supply. And so the province took the approach of giving vaccines to certain pharmacies who had completed a fairly substantial amount of flu shots in past, because they want to make sure that wherever they're distributing these vaccines, they will be administered quickly and effectively to the population. And the other part of that was they also prioritized some areas which in this conversation we're calling hotspots, so where there are higher case numbers. So pharmacists, we have been kind of waiting to be part of this, and we are happy to be part of it now. But what has happened in British Columbia is the AstraZeneca supply has run out. And so that begs the question, can pharmacies administer, say, the Pfizer vaccine or the Moderna vaccine? And the issue with these vaccines is the Pfizer vaccine does require ultra cold storage, and the Moderna vaccine could actually be stored in a fridge for up to about 30 days, but there have been also supply issues with that one. Now, the Pfizer vaccine, technically, we've seen pharmacies in the US, and I believe there's a pilot project happening in Ontario soon, where some pharmacies there will be administering the Pfizer vaccine because it can actually be stored at room temperature for up to 5 days. It is my hope that we will also be administering the Pfizer vaccine in the future, but I do not know, because as we know, COVID-19 is constantly evolving, and we are in such a situation in the province with these variants that we know are more transmissible. Fraser Health, like Dr. Valdez mentioned, is in a very critical situation. So is Vancouver Coastal with a P1 variant. And so pharmacists, we could definitely do this, and we are ready, and we really would love to be able to serve our communities this way. And I expect that you will see pharmacists more involved as we get more supply. Yes, we're definitely ready, and it's not something that is out of our scope to do. Mm-hmm.
And I'm wondering, I guess, I got my shot around February 11th, and then we're just coming up to March, and we're thinking, okay, 30 days, we have 30 days. And then Dr. Bonnie Henry announced that it's actually going to switch to 4 months. I almost cried. And at first I didn't understand it. I thought, how are they doing this? Do they have science behind it? Is my shot still going to be good after 4 months? So I'm hoping that maybe that if you can share a little bit on what you know and sort of why that decision was made, and is that safe?
Yeah, I can start us off, and then Dr. Valdez and Lindsay can jump in. So essentially, this recommendation was actually made by NACI. NACI is the National Advisory Committee on Immunization. Now, I'd really like to stress that NACI is a separate advisory body, and it gave a recommendation, which means that each province can actually make their own decisions. And if they would like to follow NACI's recommendation is one thing, but it's not, it's not a rule that they have to follow. However, their recommendation came because they were looking at other countries that were having a successful rollout. And so, for example, the UK was one country where they decided to just have this mass vaccination of the first dose. So to ensure that a lot of people got their first dose, just as many people as possible got their first dose before administering the second dose. Now, fortunately enough for the UK, and Lindsay mentioned the supply issue here, the UK didn't have the supply issue that Canada is having. And so because of that, one of the recommendations that came down from NACI was because we have a supply issue that, they're looking up to 4 months, which is, yes, indeed, beyond the timeline of the clinical trials, for people to get their second shot. And I know Lindsay can probably speak to this more being a pharmacist, but a lot of the vaccines that we've had in the past, if you can think about it and remember, you probably didn't get them super close to each other. So if there were multiple doses, you didn't necessarily get them like 1 month apart from each other. You've probably gotten them a few months, several months between the first and the second dose. And so based on that kind of data is where NACI was coming from, although this data wasn't found in the clinical trials. And so just another point for the clinical trials, why we didn't see a lot of expansion between the first and second doses, because the companies were looking at the times that we're in. So because we're in a pandemic and we want to make sure that as many people as possible were getting the doses quickly within the clinical trials and things were being studied a little bit faster. And when I say faster, of course, I don't mean that safety was compromised. It's just that they were looking to see, what's the optimal time between the first and the second dose that people can get them, and then start to roll out the vaccines. So yes, NACI came up with this 4-month delay, but I heard on the news today that based on supply being increased here in Canada, they're looking to see a possibility of reducing that delay between the two doses once more comes in.
One thing that has been mentioned a few times now during this broadcast is the efficacy. What is efficacy of these vaccines, and what's the difference between that and effectiveness of the vaccines? We hear this quite a bit. So if you could clarify some of that terminology, that language, so people can understand kind of what they're dealing with here.
Yeah, I can start with that. So efficacy refers at a process in which you test a vaccine in a controlled environment. So you have a group of people that come as volunteers, and then you have matching people that got the vaccine and the placebo. So everything is controlled. However, we are human beings, different. We react differently. So once the vaccine goes out into the public, we don't know how people will react to the vaccine. It's the same. You don't know how you're going to react to an infection. So that's what we call effectiveness, is in the real world, what is happening. And this is not only with these vaccines, with many vaccines, we had the same. So efficacy is the data that the companies get or the researchers get when they're studying. Then out is effectiveness. We don't know. So, and right now, that's what we are assessing. So it's so new in terms of the vaccination that we don't know yet how we are responding. Seems like in many populations it's working fantastically. So then maybe it's even better. So we'll see how.
I guess, is there something else to add? To what Dr. Valdez mentioned there, Dr. Sankar?
Yeah, so Dr. Valdez covered that well. In terms of the comparisons, a lot of people are comparing the efficacies and the effectiveness. And so Dr. Valdez beautifully explained efficacy is what we see when we're in a clinical trial because it's controlled, and effectiveness is how the vaccines do beyond that. So how are we all reacting to the vaccines out in the real world? So the reason why we can't compare them, there are just several factors that are different. So number one, the Pfizer and the Moderna vaccines were actually developed and tested early on in the pandemic before the variants were even around. So, that's one thing to take into consideration. Another thing is the demographics that were covered in the clinical trials are very different. Thankfully, all of them try to cover different demographics, but the percentages of people in each of these demographics are very different. And so there are lots of different, because of these different factors, of timing of demographics within the clinical trials, it's kind of like comparing apples to oranges. Yeah. And so, for example, we saw amazing rates of efficacy. So we saw things like 95 and 94% in Pfizer Moderna. And then people are talking about, why is like J&J, for example, like 60-something percent, AstraZeneca lower, effectiveness. You have to take into consideration the variants. So the variants were present in the AstraZeneca and the J&J trials. They actually managed to capture variants in there. Whereas with the Pfizer and Moderna, they were not present within those trials. And so it's kind of like, and I use this analogy and I heard this before, it's kind of like comparing a 10-year-old boy who scores like 90% on a math test test versus like a 16-year-old girl or no, actually like an 18-year-old girl. So at university level, you know, in an astrophysics test, you know, scoring like 70%, you know, it's very different in the way in which they were assessed. So that's why it's very difficult for us to make those comparisons.
Yeah. I guess while we're on the topic, you know, of testing these out, you know, putting them through clinical trials, and I know we've talked about this on the show before, but again, it comes up over and over again in conversations that I have, and probably conversations that many of you have as well, about these vaccines being rolled out, and that is, you know, the safety of these vaccines, what the side effects could be. You know, we've heard a little bit about that. You know, during the last, you know, little bit, also, you know, about, you know, children, will children be vaccinated? Are the vaccines safe for the children? And so I'm curious to get your thoughts on a bit of that as well, because we continue to hear this. And earlier today, when I spoke with Dr. Kling here in Northern Health, you know, I asked her, was there hesitancy? Were people reluctant to, you know, get the vaccine? Because we have seen almost 90%, as she mentioned, almost 90% of adults in Prince Rupert now have their first shot, about 70% in the greater Prince Rupert area. And so clearly there always are going to be those folks out there, but clearly in that community, especially, most people bought in. Most people saw the benefit in getting the vaccine, because they saw how bad a case you can get, a case of COVID-19, and what it can do to you. You know, the Acropolis Manor was decimated more or less in Prince Rupert, and we don't want to see that happen anymore. So maybe break it down a little bit for us. You know, what's the safety protocols? This is done, you know, in record time with these vaccines. So break it down a little bit. How safe are these vaccines, and what can people expect if they do get the vaccine? What kind of side effects can they expect, if any?
Okay, yes, and I can speak to that. So I'll start off with the side effects. So the side effects for these vaccines in the clinical trials, and even now what we're seeing now in this real world that we're in, these side effects are, for the most part, very similar to what you would see with other vaccines. So often we see some headache, some fatigue, a little bit of redness or soreness in the deltoid muscle. One that has come up that I think is more common with the mRNA vaccines, and is maybe a little bit more unique to the COVID-19 vaccines, is swollen lymph nodes underneath the arm. And I think this has been a little bit worse than maybe in with other vaccines. So that's something that we have noticed has been a little bit more prominent. As to vaccine, how safe these vaccines are, I want to point out that these vaccines are still being monitored for safety as they roll out. This is what they kind of call this the phase 4. They do call it the phase 4 clinical trial. But all vaccines, all medications in Canada are monitored always for any adverse effects. And we report, as pharmacists or as healthcare professionals, we have a duty to report any adverse effects that are outside of what we would consider normal, which would be like those side effects that I've already mentioned. We do that because, like Dr. Valdez was saying, real world efficacy or effectiveness is a bit different. And sometimes we do have different things pop up that, even though there were maybe 40,000 people in these clinical trials, which is huge for clinical trial, there are still some things that could pop up. And so this is pharmacovigilance, and it's very important. And this will continue as long as these vaccines are being used. As to if these vaccines were rolled out too fast, I think that Dr. Sankar was speaking about that a little bit. No corners were cut. There was no, there was funding that was provided. There was a lot of funding behind this. There was the global community was all invested and focused. They dropped whatever project they had. And we had, I think it's about 40 clinical trials that were working on producing vaccines. And not all of these vaccines were successful. Many dropped out. And the regulatory process for approving these turned out to be what we call a rolling, sorry, I'm losing my train of thought here. But so what they did is they were actually analyzing the data in real time rather than waiting till the whole trial was over. So they were actually able to approve these vaccines a little bit faster, but they did not skip any steps. And something else that accelerated the process was that, unfortunately, because this is a global pandemic, we have very high, or had and haven't still in some cases, very high infection rates. And it was very easy to recruit volunteers for this study. So it's a very unique situation. And I completely understand that people want to know, because when I remember in school, when I was in high school, we learned that vaccines take 10 years to produce, and they usually do, but this is a very unique circumstance. And so I completely understand people who have questions about that, though, but I do want to reassure everyone that no steps were skipped. These are safe vaccines. There is always an element of risk with any medication or any therapeutic, but this is being monitored very closely by our provincial and federal governments.
And I think we could look at the AstraZeneca vaccine, that's a great example of that, right? Because the age kept going down as to what age level they wanted it. I think it's down to 50 now. Might be
30.
even lower than 30. Wow, that went by quite fast.
In British Columbia, yeah.
Yeah, and those are great examples of constantly monitoring real time and then coming back with a plan. I think that was great. We heard a lot about herd immunity. And, one of the things that we're in our Northern Health Authority, and my family all lives in Prince Rupert. So I kept sort of watching and seeing if I can, not to go visit my family, but just be in my home community, right, in Prince Rupert. And I had no idea what herd immunity meant. Like, does herd immunity mean that everybody in Prince Rupert are now protected? And how protected really are we? Is it something that we should let our guard down or still be vigilant? Or maybe you can share with us something on that.
I can start with that. This is an interesting terminology. When herd immunity, it's called, population or community immunity. That's the real word. So it refers to the percentage of people that are immune to a disease and reduces the risk of infection to other people. And this is happening with many of the diseases that we have. Polio, for example. So polio is almost eradicated. It's not yet, but most of us are vaccinated against polio. So if there is a chance that somebody has, it's even if you get the virus, you are protected. So then the virus will stop. You stop the transmission. So that's what we call it, population immunity. So it's a good percentage of people that won't allow the virus to transmit from one to another. But in any circumstances that you reduce this percentage of protection of vaccination, you start increasing again the cases. And this is happening in certain populations in which there is vaccine hesitancy, and you start again, you see how other diseases are coming back. So this terminology is for us to refer that if we as a community get vaccinated and we reach around, for this virus, we are thinking around 70 to 85% of the population, there will be other people that are, they have many diseases and they can be, they're like vulnerable people. So those people perhaps won't be vaccinated because we are protecting them. So it's a community effort. So that's, I don't know if that answers your question.
Mm-hmm. Yeah, certainly. And I think one of the things I also wondered about was, is this going to be a yearly thing that we now do with, it's kind of like the flu shot, right? I get my flu shot yearly because I have autoimmune disease. So I'm always protected. But are we going to go into a place where we're doing this at a yearly shot thing?
It's hard to know at this point. Again, as Dr. Sankar explained before, so we tested the vaccines against the original variant. So now new variants are coming up. So are our vaccines, current vaccines, are protecting us against those? We realize that there are certain vaccines that are not as protective with certain strains. So depending of the population, like in which, like I showed before, in different communities, you might have a different variant. So you might have a booster for that if it continues going. So at this time, we don't know. We are just watching the dynamics of that vaccination versus variants. So then, who knows? Maybe we might.
And I can also just speak to, we were talking about Prince Rupert earlier, and Prince Rupert is like this, we can use it as if it's like almost a microcosm of what we want to see in British Columbia and throughout Canada, but we are not there yet. And so Prince Rupert is not its own little isolated community, even though it is maybe somewhat isolated. But the rest of British Columbia, we are seeing very high rates of transmission, and we still have very low vaccination. And there will be people that were vaccinated that did not have as strong of a response as we saw in the trials, because everyone's biology is different. People have different chronic illnesses. And so we need to be aware of this as well. And that's why some people say, why should I get vaccinated if life doesn't change? Life will change. As we see more people get vaccinated, we will see community transmission decrease, which is what we've seen in Prince Rupert. And we just need to get this, right across the province, eventually across the country. And then these, what they call layers of protection, right? But Dr. Bonnie Henry always says that these will gradually fall away because, and the other benefit here is that as we reduce community transmission, we do not leave ourselves vulnerable to more variants, right? So I think that the Prince Rupert example is excellent because you see how effective these vaccines are. And this is where we really want to get to, because when we have this province-wide, when we have this nationally, we will really start to see what life post-COVID is like. Even if we still have, some cases, it'll be more manageable. And so getting the vaccine is getting us one step closer to that post-COVID world that everyone wants. So these measures will gradually fall away. We've been limited by supply a little bit, and that's kind of, made the rate or the pace of this a little bit longer than we all expected. But it's going to get better, and Prince Rupert will hopefully not be the only success story as these weeks and months go on here.
And I think that's a good example. And one of the things that I realized is when we all got our vaccines, I think, sometimes we got a little false sense of, we're safe and we're protected. And that's not necessarily true. I had a relative that got vaccination and then got COVID after that. And what I think was a little bit different is it was more like a cold and really uncomfortable, but it certainly didn't go really, really bad. So I think that's one thing for us to remember is that although you got your first shot, it doesn't mean that you are immune to it. In fact, if we be more diligent. But I guess the other question I had was, when someone has caught COVID, does that give you some sort of, it's kind of like having a shot is what I heard, that it builds up in your system and you can't get a shot until 3 months after you've had COVID. Can you tell me a little bit more about that?
Yeah, so of course, if you've been infected with COVID, it means you've been infected with the virus. So naturally, your body will build up those antibodies. It will create the immunity to the SARS-CoV-2 virus. So I guess in a way, it's kind of like saying you had your first shot, although I wouldn't want to say that's like having your first shot, but you did build up some immunity to it. And so that's actually why, though. And then I usually get this question too. So people are saying, well, if I got COVID already, then I'm immune to it. So why do I still need to get the vaccine? So I think it's really important for people to recognize that, okay, it's great that you survived COVID, but a couple of things. We have variants. We don't know necessarily what strain of, the SARS-CoV-2 virus you got. And so to ensure that and we also know there have been instances of reinfection, although not very much, but there have people have been known to become reinfected. So the first thing is you want to still protect yourself for possible future reinfections. Secondly, you don't know what strain you got, so you'd like to protect yourself potentially from getting a variant in the future. And so thirdly, you don't want to catch COVID anyway, because you have long-term symptoms that follow COVID, which are awful. There have been lots of reports of, the things that people suffer from for the long-term effects of COVID. And so if you've had COVID, you should still get vaccinated. It just depends on the length of time. So obviously, well, right now we know that if someone has been infected with COVID-19 or the SARS-CoV-2 virus and has gotten COVID-19, that they need to wait a period of time before they get the first vaccine. Right now in Canada, I believe, well, especially based on the supply issue, it's saying somewhere between 4 and 6 months before you get your first shot, and then you start your whole, your whole vaccination series. So if you're getting a 2-dose vaccine, which is most of the vaccines that we have here, you start with your 2 doses, or if you're fortunate to get J&J, which is just the 1 shot and done, you get your J&J vaccine. So I think it's really important for people to remember that aspect of it. So even though you might have had COVID before, first of all, we don't want to be getting it because we don't know what type of long-term effects we'll have, but you still need to get vaccinated after the fact.
Thank you. I think, and I'll push back to Dan. I really want to thank all of you for coming and sharing this information is so really important. And I love that we can do it virtually because you guys are all across the country and we wouldn't necessarily have the luxury of having you in the Northwest. So I really do want to thank you. And I think I was telling Dan the other day, and I think even the guests, that I was watching as the United States, as their numbers are starting to come down now because of the vaccines. And Disneyland is opening on April 30th, and I've watched people on these YouTube crying when they're going in there, and it's because it's symbolic, right? Life will go back to normal. We just all have to do our part to make sure that we are contributing to that herd immunity so that we can all be safe. Dan, can I throw it back to you?
Yeah, of course. Thanks, Christine, and thanks everybody for being on the show this evening. Amazing work that you all are doing and information that you provided here for residents living in the Skeena. Very much appreciated. I mean, yeah, just to reiterate, ending on a positive note, we're rolling into the second year of this pandemic. Things are starting to look much better than they did a year ago. Despite that, we're seeing a third wave in certain parts of the country, here in the Northwest, as well as around the world. We are starting to see these vaccines roll out. Here in BC, we've seen about 1.7, just over 1.7 million vaccines administered so far. So that's a good sign. Of course, the story coming out of Prince Rupert, clearly a case of the benefits of making sure that people do get vaccinated, especially here in the Northwest, in isolated communities. We don't have the facilities to deal with, high numbers. There were a lot of people who were being shipped around the Northwest to deal with, hard cases, bad cases of COVID. So really good news coming out of Prince Rupert. And of course, we're kind of starting to turn the page here. We're seeing these rollouts happen, and that's really great news. And we're going to continue to see them happen. Although there are some delays, the ball is rolling. And that's the most important part here. On the same note, as you mentioned earlier, seeing the senior homes, at the beginning of this, we were seeing devastation in a lot of those long-term care facilities. We're not seeing that to the same degree anymore. A lot of those folks have gotten their vaccines, and we're seeing the repercussions, the benefits of what that means for them. And also at the end of the day, even healthy people who have gotten COVID have gotten bad cases and like you said, lingering issues months and months later. And healthy Olympians, we're seeing stories about Olympians, some of the most healthy people out there that train constantly, that are more healthy than most of us, put together. And even when they get hit with COVID, it can be very severe and long lasting. So definitely, despite some of the hesitancies that people have, the benefits outweigh the risks in terms of the vaccines. And definitely, as was mentioned on the show many times this evening, having the vaccine and a little bit of uncomfortable side effects is a lot better than getting a hard case of COVID that could put you in the hospital or even worse. And so, ending on a positive note, this great story coming out of Prince Rupert. I hope we hear more of those. So I'll end it there. Thanks again for everyone for checking out Skeena Strong and joining us. There will be more of these conversations in the future, not just on COVID, but on many topics that are important to people here in the Skeena. And we look forward to providing that information to you, up to date and factual, evidence-based information. So thank you so much for joining us, and we'll leave it there.